Hey there, awesome folks. This is Mentor Shelley, wanting to make sure that you become a better version of yourself professionally, guys. I am here to discuss in a little bit more detail tonight the professions from homemaker to healthcare, proven steps for ex-trad wives to transition into which can become a very lucrative career in healthcare. We're going to focus on a few of the entry level positions that you can start with because it does not take a lot of time to get involved in that industry. But before we get started, I'm give you a little time to get in here and get started with us. Stay tuned, guys. Hey there, awesome folks. Hey, I just want to make sure that you are here. Go ahead, as you are coming in, go ahead and like, comment, and share this with any ex-trad wife or trad wife looking to make a transition back into the job market and may be interested in getting involved in the healthcare profession, in the healthcare industry, in the healthcare occupations. Now, I want to make sure you have the core resources needed to get involved in this career field. Now, it turns out when you initially get started, I want you to understand where to find the information so you know exactly what you're getting into. And as an ex-trad wife, there are a lot of the qualities that you may have and not realize that you have. And I want to make sure that you understand what's required to get involved in that so you know that you have what you need and you are prepared. Now, I am on the website bls.gov, and I'm actually going to put that in the chat tonight. Let me go ahead and add that to the chat here on YouTube. And also add it to the stream. So those that are watching from other places, from not Instagram, but in Facebook and other places, you can go ahead and look as well. You want to make sure, let me make sure we get better full screen here so you can see it. Okay, when you're looking to any type of, if you're looking to research a career field, this is one of the first places you're going to look, bls.gov, because it has the information, has salary information, what is going to be your best bet as far as what's involved, things of that nature. So we came right to healthcare occupations. And some of the ones that we're going to be focused on tonight is, let's see here. Yeah, we're going to be talking about ways that you can get involved entry level. Not going to pay the biggest bucks, but it's going to give you a start in that industry. We first want to talk about certified nursing assistant, and I want you to remember 5 things. We're going to talk about the duties that the certified nursing assistant, or CNA, that's called for short. What are the duties that are required for that particular field? What's the salary range? What's the certification required? And what are the skills they highlight? And what kind of training may be required? So before we go any further, let's go ahead and find CNA, certified nursing assistants. Did I pass by it? No. Or nursing assistants, because it may be that you may not have any specific skills in this area. Where we go. Nursing assistant. So This is a great outlook giving you a summary of what to look for. If you're spot checking or you're doing quick research or you want to delve a little bit deeper as to what's involved in this career, you can watch this video here. And you can also, let me see. Go ahead. Let's go.
Every hospital, clinic, and nursing home relies on a team of skilled staff to provide personal care to patients. Nursing assistants and orderlies are an important part of that team. Under the supervision of nursing staff, nursing assistants provide basic care for patients, while orderlies transport patients and clean treatment areas. Nursing assistants answer patient call signals, turn or reposition bedridden patients, and ensure each patient receives the appropriate diet. They help patients with daily living activities such as getting out of bed, using the bathroom, bathing, and walking. Nursing assistants measure vital signs such as blood pressure and temperature. They observe and listen to patients' health concerns, then document and share them with supervising nurses. Orderlies move patients between bed and wheelchair or gurney, change bed linens, stock supplies, and clean facilities. Most nursing assistants work in nursing homes, hospitals, assisted living facilities, and in-home healthcare, while most orderlies work in hospitals. Nursing assistants and orderlies typically work full-time, and their work is physically demanding, with long hours spent on their feet and lifting and moving patients, so injuries are at a risk. Work schedules that include nights, weekends, and holidays are common. Nursing assistants must complete state-approved training lasting from a few months to a year, then pass their state certification exam. Orderlies typically have at least a high school diploma or equivalent and receive on-the-job training.
All right, that gives you a better sense of what to expect. And as you are coming in, say hello, wave. We speak around here when it comes to what is involved here. Let me add this back. All right. Yeah, we just want to make sure that you have the information you need to make proper decisions as far as where you're going to transition to. Now, what did we say? We want to talk about, let me see here. We want to make sure you have what are the duties. They went over the duties in the video. And what's the salary range? Salary range can go from 30, average 38,000 a year. It's not, it's median salary depending on where in the country you are. It's not the highest salary in the world, but it's not the lowest either. And if you're starting out, it's better than zero. Let's put it like that. And what do? They pretty much take care of patients, whether you're in the hospital, nursing home, or in the home privately. So pay, you see pay here, the job outlook. What type of duties are required? You can actually, what do they do? Right? Typically, what type of skills is needed for this? Compassion is absolutely one of them. As you can tell here, listening to patients, measuring patients' vital signs, serving meals. As an extra wife, you are doing a lot of these kind of things with your children. So transitioning to a nursing assistant or an orderly is not that big of a leap. It's just that you'll be getting paid a salary to do this for most likely elderly patients or patients that are disabled or patients that are not mobile, things of that nature, whether it's because of age or because of some form of disability, accident, depending on what it is. Your work environment can vary. We did talk about that. Hospital, you can be working for the government. You can be working for a private duty in-house. So, because some private duties pay more. And timeline wise, how do you become one? They have programs that are as short as 3-4 months, 3-4 weeks. And you have some CNA programs, certified nursing assistants, that may last up to a year. Keep in mind, orderlies may not have so many requirements, but you get the idea that if you want to be a certified nursing assistant, you're going to have some state approved education based on the state that you're in. So this website also helps to help you to decipher what the job outlook is, right? How, where, totally where nursing assistants are, how, what's the outlook for that particular job. That information is also here. You can look to see on average statewide what's involved, what kind of salary, what's the projection, things of that nature. You get the general idea. How do you become one? What's involved, the certification, registrations, things of that nature. You see the special requirements here. But at the end of the day, understanding the important qualities as an ex-trad wife, you have communication skills, which you've had to form, compassion, that comes naturally if you're compassionate, and you can also learn to be compassionate. You've been a trad wife for a while there. That's part of being a trad wife. Having patience for, routine cleaning, feeding, bathing, whether it be your children or the patients. You've been doing that anyway. Physical stamina. To keep up with children, you are going to need stamina. So, of course, these are all skills that you already have as a trad wife. So, making the transition to become a nursing assistant is not that big of a stretch as an ex-trad wife. So, I want you to keep that in mind. Let's take a look at medical assistant. Their requirements are a little bit different. So how do we find out what medical assistants are? Where do we find that information? In the same spot. Remember, we're in under the healthcare. So all of these professions are listed here. Okay, so we're looking for a medical assistant now. Let's go further down. The link is in the chat. Let's see here. Medical assistant. Let me go ahead and put let's see here to make this go a little bit faster. Okay. Uh-oh. Okay. Let's see here. All right. Medical assistant. Okay. All right, let's find this, guys. Hold on a second. We're having a little technical difficulties tonight. That's fine. It's fine. It's always good to have your backup. Okay. Let's see here. Okay. Now, let's go back for a second. I want to make sure you guys understand. I want you to have the information necessary to be able to make that transition. If you're looking to get into other professions, let me make sure I have the right link here so I'm not giving you the wrong information. Okay. No. Okay. Here we go. Now, we have gotten, here we go. Now, let's get back to that medical assistant. Now, medical assistant, the pay is a little bit better. It's $20 per hour on average, or $42,000 for the year. What do medical assistants do? This is just a summary of the particular profession. Medical assistants complete administrative and clinical tasks such as scheduling appointments, and taking patients' vital signs. How do you become one? there's a certification program that you can go through some can do it through their high school diploma. Some high schools offer this as an additional curriculum while getting your high school diploma, and there are other vocational schools that offer this as well. You can actually use this very same website to see which schools in your area offer this, or if you can get an online version to this. 9 times out of 10, I think you do have to do a in-person course in regards to this particular profession. Now, concretely, what is it that they do? Medical assistant interview patients and record medical history, measure patients' vital signs, such as their blood pressure, weight, helping physicians and patients' exams. A lot of where they do their work is in either in a doctor's office or in a hospital. There's additional responsibility. They're a step above being a CNA. So their work environment, as I stated, is going to be in largely in a doctor's office or in a medical facility, whether it be a nursing home, rehabilitation center, places like those. How do you become one? The education piece may take a little bit longer. It may take a year or two, depending on the type of program, whether it be through vocational school or in an independent program that the state approves. It all depends on where you live and what they require for this particular certification and licensing. You, of course, although most states don't necessarily require it, employers may prefer that the medical assistant, be certified. Go ahead and get your certification. And as ex-trad wives, these are professions that you can definitely transition into because you have the qualities, analytical skills. In order for in order for you to be able to to handle some of the duties that you had as an ex-trad wife, analytical skills had to be part of your life, or had to be something you used, so you can use that to transition into becoming a medical assistant. Communication skills, of course, compassion, detail oriented, interpersonal skills. You have to use those to be able to communicate with the physicians, communicate with the patients, and be able to interact with all parties involved. Be courteous, being professional. Of course, the pay, let's go straight to it. Pay range can be from, it says here, between 40, actually this is closer to 50,000, between 33 to 50,000 a year, and the list goes on. Of course, we're going to look at all of these. I want to make sure you have what you need, so when you're making this transition, you understand what's required. It may be 1 to 2 years for you to go to vocational school or community college that has some of these programs available. Of course, you would have to go to your specific local state or county to get information, area information, as far as they see their product central. You see here, you can click here and it actually takes you to another area where you can look to see. Oh, you're not able to see that. So it can actually take you and show you what what schools are available to be able to get into those programs and finish that. What the point of actually going through these is to make sure you understand that you have options as an ex-trad wife. You have options to go ahead and make a transition into the healthcare fields. It's not something that's impossible. It may not yield the big bucks right away, but what you can do is start off in some of these entry level positions, such as, let me see here. Let me go back. All right. So medical assistant is one of them, right? Medical assistants. Home health care, home health aides. They're a little bit lower on the totem pole. They pay a little bit less. but their duties are similar. You can transition fairly easily. Their duties pretty much say home health care aids monitor and conditions of the people with disability and chronic illnesses and help them with daily living, with activities of daily living. Let me see here. It's home care or personal care, right? So you see the pretty much the pay here. The average is 33,000 a year, give or take a 10% difference there. And some states require a certification, some do not, excuse me. Um, and of course, you guys know, let me see here, how to become one. The training for this, I've heard of HHA programs, some of them taking as little as 2 weeks, a few months, depending. And of course, the qualities that you'll need, you need to be detail oriented, have emotional, intelligent skills to be able to deal with patients that are going through extreme pain and distress based on their illnesses or their disabilities, and be able to, communicate with patients that have cognitive illnesses like dementia and Alzheimer's and things of that nature. Communicating with them with integrity, interpersonal skills, and have the physical stamina to be able to keep up with the patient load if you're in a facility attending to more than one patient. At the end of the day, I want you to be aware that your your transition into the healthcare field is not as impossible as some people may make it or they may think. You go from any one of these professions, whether it be medical assistant or home health care, right? Home health aides, or even a phlebotomist. That takes a little bit longer. Phlebotomists, I don't know if you guys are aware, they draw blood um, for tests, transfusion, research, and blood donations. Their salary range can range from 33,000 to 55,000 a year. Let me go ahead and put that on screen so you guys can see. Okay, let's see, phlebotomists. Go further down, so you guys can go through this list on your own to see which healthcare profession you can transition to fairly easily. It can range from, let me see, how to become one. There are, of course, in some cases, there are some high schools that offer this, but of course, I'm talking to the trad wives or ex trad wives. You can go through post secondary phlebotomy programs, can take less than a year to complete in vocational or in community college settings. And of course, there are most states are going to ask you for, of course, a state certification or licensing of some kind. So that would behoove you to go ahead and do more research. But of course, some of the similar qualities apply here: communication skills, compassion, being detail oriented, having dexterity to be steady with your hands. That's what dexterity really means. I'm sure you've had to take a splinter out of a child's foot, so dexterity should come natural to you as an ex-trad wife. Interpersonal skills, you're dealing with patients, so that's part of it, just like you were dealing with your family. You have the interpersonal skills to do that and physical stamina to be able to keep up with your patient load. At the end of the day, I want you guys to understand that there's more possibilities here than not. Don't let anybody fool you, or don't let anybody say that the healthcare professions is not. Yeah, of course there are some of you that may end up working to become a nurse. If you're in any one of these starter healthcare professions, such as a medical assistant or HHA, which is a home health care assistant, or certified nursing assistant, phlebotomist, or any one of these healthcare fields or any one of these healthcare professions that start off, they may not be in the pay grade that you desire, but it's a stepping stone to get you to where you want to be. At the end of the day, I want you to know, I want to empower you that you think you don't have the skills, but you actually do have them. And you actually have what you may need. If you don't have those, then you can, then of course, we went over exactly what you are going to need. Maybe 4 months of school, 4 months of going to a class at a technical college, technical, or what do you call it? You could go through community college, or you can go to trade school to obtain the skills needed to start off this in all of these fields. Patient care tech, nursing assistant, to start off. And then you can transition into becoming a registered nurse, which of course that's where some of the big bucks come in, or become a bachelor. You can definitely earn your bachelor's in science and nursing. So these careers, these start off careers, are stepping stones to get you into the healthcare profession on a much larger scale. But it's best to start from somewhere. And of course, if you're looking to get started in any of these professions and you're not sure where to start, if you have the skills, you have the skills. I just want you to be aware that you have the skills. Some of the things that are required, we've already gone over. You need to be caring. You need to pay attention to detail. You need to be able to have steady hands to do some of these things, caring for the patient, keeping the patients mentally sound when you're taking care of them. All of these things are things that you are doing as a trad wife anyway. So you want to make sure you carry those, use those transferable skills in the healthcare field. Guys, and of course, if you're looking for ways to define what else you have to offer in the job market and you're not sure where to start, you can go to mentorshelley.com/ETW. That is the economic guide. It is free for now. I'm going to be working on adding some more things to it, and it's going to be for sale in 2025. So grab it while it is still free. And of course, if you're looking to work with me directly to truly define, as far as getting your career tools and things of that ready to be able to take the job market by storm by getting involved in these fields or other career industries, and you work with me directly to get those things situated and get your career strategy on board, you can go to mentorshelley.com/consultations, schedule that consultation with me, and we will work together to get you on the road to returning to the workforce, empowered with a plan, ready to execute, so you can become a better version of yourself professionally and become more self-sufficient as you return to the job market after years of being gone. At the end of the day, I want you guys to have what you need to become empowered, to become a better version of yourself, and also to become self-sufficient. All right, guys, take care. This is Mentor Shelley, wanting to make sure that you become a better version of yourself professionally. The healthcare professions is where it's at because you have a lot of options, but use the resources you have and the resources we discussed in this video to get started. All right, guys, take care. You have a good one. Bye.